Low testosterone is a very common problem. So as we age, after about age between 20 and 30, our testosterone starts to go down.
So is it low, or is it just part of the natural aging process?
So it depends on the individual and depends on your symptoms and how it negatively affects your life. That's how you kind of determine what to do about it. But generally speaking, it does go down over time. In younger people, the incidence can be in the 2 to 12%, but men over 50 years old is in like the 30%, and over 80 years old, it's even as high as 40 to 50%. Not everyone that has lower testosterone necessarily needs treatment. It really depends on a whole host of factors. So first of all, how would you even know if you have low testosterone? What kind of symptoms would you have?
Well, you'll have decreased energy.
Number one complaint is people feel like they have no energy. They're tired all the time. Doesn't matter. They're tired.
Your mood can be down.
Yeah, so you can be depressed, or you could have big mood swings are part of it. Reduced libido and sexual functions. So not only the desire to have sex, but also your ability to have sex can be drastically reduced, as well as decreased muscle mass and decreased bone density. So osteoporosis, something that can even happen in men as their testosterone goes down. So low T leads to low, a whole bunch of things.
Yeah, low to low.
Right, so how are you gonna find out or diagnose this problem? You're typically gonna go to your doctor. They're gonna do a blood test to look for testosterone, a combination of either total testosterone or free testosterone. Usually this is best done in the first 3 hours of being awake, because that's when our testosterone is the highest, and multiple levels. So you're not gonna do it once and go, oh no, my T's low. You're gonna do it multiple different times just to make sure some of those other variables are controlled for, and then that would give you the diagnosis of normal or low testosterone.
Yeah, but not everyone needs to go get their testosterone checked. Definitely
Agreed.
not. If you're experiencing several of these symptoms and feeling this way, then maybe. But the average person, if you're in the absence of those symptoms, you don't need to have your testosterone.
Agreed.